Good evening, everyone. My name's Gina Ogilvie, and I'm a physician, a professor, and a Canada Research Chair at the University of British Columbia. I'm just delighted to be invited here by the Walrus and Universities Canada to share my perspectives on research and innovation in Canada. As a clinician scientist, daughter, mother, wife, cousin, friend, and of course patient, what I will say is this: research is healthcare. The care you or your family or friends received yesterday, last year, last decade, even in the last century, is research. Healthcare is the end product of research, and every Canadian and every person globally benefits. And I can assure you that some team, last month, last year, did unheralded and unsung work that provided your clinician and you with the evidence base so they could optimally direct your care. And they are working on that right now to provide you with the best care for tomorrow. I was drawn to research early in my career in medical school, and particularly to women's health. It was very apparent to me that if we wanted to improve the health of the world, the most effective and efficient way to do that was to make sure women were healthy and living their best lives. Because not only did the women, for their own dignity and humanity, deserve to be healthy, but it was clear from all the evidence that if you keep a woman healthy, her children, her spouse, her family, and her community all benefited and were themselves kept healthy, educated, and thriving, making women's health one of the most cost-effective investments we can make. Working in an impoverished community in the north end of Hamilton after graduating medical school illustrated in stark and unrelenting relief the inequities that women faced in terms of healthcare, particularly in the area of prevention. I saw firsthand how women would bring family members, parents, children in for care, but did not have time for themselves. And I saw particularly how many women would avoid the then yearly cervical cancer prevention tool, Pap smears, in particular, despite their preventive benefit. They didn't have time to come in every year to do a Pap smear. It was complicated to arrange their work schedule, childcare, transport, and the Pap smear, because it couldn't be taken during their periods, added a uniquely female wrinkle to planning. And many, frankly, just didn't want to undergo the pelvic examination that was needed to conduct the Pap smear. It was too traumatizing, particularly for those who were sexual assault survivors. So based on very legitimate concerns and realities, women were not engaging in a critical cancer prevention opportunity. And I also knew that while Pap smears were useful, their accuracy was, in fact, limited. And how we addressed the diagnostic limitations of Pap smears was by repeating them frequently, in hopes that the Pap smear, the next year's Pap smear, would catch it if we missed it this year. So this was a problem that needed solving. Cervical cancer is a preventable cancer with a long natural history, permitting ample time to detect and treat precancer. And while now there's a vaccine, it's a preventive vaccine. And so for the many hundreds of millions of women who've never been vaccinated, they deserve a better screening experience. We urgently needed a better screening tool, a tool that was more accurate, a tool that was more acceptable. And so this is where research shifted the landscape. First off, our basic science colleagues, our brilliant, vital colleagues who are the unsung heroes who explore the biological underpinnings of disease and help provide us with a blueprint for clinical care, determined that cervical cancer was caused by the human papillomavirus. And that knowledge catapulted the field forward and allowed the clinician scientists like me to get to work. We all mused, would detecting HPV in women, could we prevent cervical precancer better than with Pap smears? By this time, I'd moved out west to British Columbia, and so our multidisciplinary team of OB-GYNs, cancer, family physicians, infectious disease, lab medicine specialists, among all others, recognized that here in Canada and in BC, we were uniquely poised and right-sized to answer the question. We had the expertise, the population, the healthcare system, the academic system, and the infrastructure. And that allowed us to lead a world-class trial in British Columbia to answer the question. And while other settings, the UK and Italy in particular, were embarking on trials of HPV and Pap versus Pap smears, they had much more complicated and convoluted design due to their healthcare systems. And if you know about clinical trials, simpler is better. And we were able to do the simple and straightforward trial. So in 2006, we applied to CIHR and received funding to lead the landmark HPV focal trial to answer the following question. Was HPV testing better than Pap smears for detecting cervical precancer and ultimately preventing cervical cancer? Between 2008 and 2012, our team recruited over 25,000 women through family physicians and primary care centers in the lower mainland of British Columbia. And we randomized each and every one of those women to receive either HPV testing or Pap smears for cervical screening to answer that question. We followed these women initially for 4 years to 2016 to address the primary trial outcome, but we've continued to follow them now up to 2 decades. And yes, just a reminder, 2008 is almost 2 decades, just for folks here. And we're going to continue examining the ongoing benefits of HPV-based screening. Our findings, which were published in 2018, were clear and unambiguous. HPV primary testing for cervical screening offered vastly improved protection against cervical precancers compared to Pap smears. And if a woman was HPV negative, she was highly unlikely to develop cervical precancer. At first, we had for the first 4 years, but now we know for at least the next 10 years. We demonstrated that screening with HPV every 4 to 5 years was safer and more effective than Pap screening every 2 years. We also did research that leveraged another critical aspect of HPV. Now, unlike Pap screening, where we needed to visualize the cervix in order to take the specimen, we can test vaginal samples with HPV, and we don't need to sample from the cervix. And women can collect the samples themselves. They do not need to undergo a pelvic exam. So now there's no need for women to go to a clinic, more or less undergo a pelvic exam to accurately be screened for cervical cancer. And the work continues. As a researcher, I'm exceedingly grateful for the public investment, and we take our responsibility to steward those dollars carefully. We're now examining the impact of HPV testing 2 years out, and we're looking to see if, given the improved accuracy of HPV testing, whether a woman who received HPV testing at 50 and 55 can actually exit screening earlier because of the remarkably improved accuracy, once again offering women better health care, healthier lives, and saving healthcare costs. So back to the challenge laid out for us to answer. How is Canadian research important to the average Canadian? Well, actually, let's start globally. HPV testing is now recommended instead of Pap screening for cervical cancer prevention globally by the WHO, by PAHO, by the European Union, Australia, the US. And the HPV focal trial has been foundational in those recommendations. In Canada, the Canadian Partnership Against Cancer, SOGC, Gynae Oncologists of Canada, and other expert screening and cancer bodies have all recommended the move from Pap smears to HPV testing. And Canadian provinces like British Columbia, Ontario, Quebec, and PEI have already moved to from Pap screening to HPV testing, and most provinces are en route to making this transformative change in one of their largest screening programs and embedding self-collection as part of that option. So every female in Canada will be directly impacted by this study as cervix screening is transformed, and every Canadian will benefit as they improve the health and well-being of the women in their lives. Our HPV focal study, our Canadian study, our study funded by CIHR is one of only 4 studies worldwide that provided the highest level of evidence to justify this transition. So this Canadian research is impacting the lives of every woman, not only in Canada, but around the world. And as this example has shown, by building off the critical work of our unsung heroes, those brilliant creative basic scientists who provide the basis for our work, and moving through the channels of scientists, practitioners, and patient advocates, Canadian research is impacting the lives of Canadians and people globally on a daily basis and in a real and tangible way. Thank you.